This is Sally's story. This is Sally. Sally is very excited and happy. Sally and her partner Bob have found out that they are expecting a baby. Sally has all the normal feelings that any woman would feel when they've just found out they're pregnant. However, Sally has a secret. Sally feels ashamed and worried about her mental health. She is worried because she has bipolar disorder. Sally is scared to see her midwife. She is frightened that people will think that she's not a good enough mother. She stopped her medication out of fear that it will hurt her unborn baby. In the past, Sally has experienced highs and lows known as depressive or manic feelings. When Sally is low, she has feelings of intense depression and despair, and when she's manic, she has feelings of extreme happiness. However, these can lead her to do things outside of her normal control due to her lack of inhibition. Sally doesn't know what caused her bipolar disorder. It is understood well, but research suggests that bipolar disorder runs in families, or there may be a physical problem with the brain systems which control Sally's mood, which is why bipolar disorder can often be controlled with medication. Sally is worried about talking to Bob. She doesn't want him to worry. Today, Sally is going to see her midwife, Alice. Sally is very nervous, but Alice looks friendly. Alice explains to Sally about what having bipolar disorder will mean for her pregnancy. Alice reassures Sally that this will not affect her ability to parent her child, but support can be accessed if required. Alice discusses with Sally a plan of care. She explains to Sally that it would be a good idea to make a referral to her consultant obstetrician, perinatal mental health team, and any current psychiatrist that Sally is under. Alice reassures Sally that this is to ensure that everyone works together to make sure that Sally and Bob and their unborn baby's health and welfare are cared for. It is important that Alice, as the midwife, is the coordinator of the multidisciplinary team. It is Alice's role to ensure that appropriate referrals are made and to follow these up. Alice needs to have excellent communication skills, be an advocate for Sally and Bob, and provide a reassuring, sensitive, non-judgmental approach. Alice needs to document all referrals and any care and information given in Sally's notes as per Trust and NMC guidelines. Alice can use the NICE antenatal and postnatal mental health guidelines in order to inform her of the best care pathway. Alice can also seek advice and guidance from her management team and supervisor of midwives. Alice needs to provide emotional support to both Sally and Bob, as this can be a very anxious time for Bob. Sally's pregnancy is progressing. She has been seeing her midwife Alice regularly throughout her pregnancy, as Alice offered Sally the opportunity to have more frequent appointments. She has had her appointment with her consultant obstetrician at 16 weeks, who has informed her of her options. She has been in contact and received support from the perinatal mental health team, who have advised her regarding her medication and things that she can do to look after herself and her unborn baby. Sally has been given lots of information and has had the opportunity to discuss any concerns as well as be involved in the planning and implementation of her care. Sally is aware that she will receive additional postnatal support and that immediately after the birth, the neonatal team may be asked to attend to check the baby for any withdrawal symptoms. Sally isn't worried about this as she's been given plenty of warning and explanation of why this might occur. Sally is aware that her midwife, Alice, will work closely with the perinatal mental health team as well as the health visitor to ensure that Sally and her baby and Bob are doing just fine. Look at this. Sally is delighted. She has had her baby. She has felt supported and she no longer feels worried or ashamed about her bipolar disorder because it is part of who she is. This is not the end of Sally's story. She will receive lots of support over the coming years, and in the future, should she decide, maybe Sally and Bob will try for a little brother or sister for Rosie.